Welcome to the 1 minute CME on Benfotiamine role in metabolic syndrome. I am Dr. Sumita, pharmacologist from Chennai. Metabolic syndrome is also labeled as Syndrome X or insulin resistance syndrome. American Heart Association in 2005 defined metabolic syndrome as having at least 3 of the 5 components: elevated waist circumference, low HDL cholesterol, elevated LDL cholesterol, elevated BP and elevated fasting blood glucose. So, visceral adiposity is an important trigger factor for progression of metabolic syndrome. Chronic inflammation, neurohormonal activation, insulin resistance mainly are the key essential players for transition of metabolic syndrome to type 2 diabetes mellitus and cardiovascular diseases. So, in an animal model study where antidiabetic effects of benfotiamine was evaluated in a genetic model rats, benfotiamine 200 mg per kg for 7 weeks showed decreased body weight, reduced adipose tissue weight, and also there is decreased fasting blood glucose when compared to control rats. Benfotiamine also restores insulin sensitivity by upregulating AKT phosphorylation. In a clinical trial where 40 patients of type 2 diabetes mellitus with disease term of 1 to 6 years was evaluated, benfotiamine 300 mg per day for 3 months with add-on to standard therapy, it showed a decreasing trend in insulin resistance index and there was a significant reduction in inflammatory markers CRP and TNF-alpha levels. In a crossover trial in hyperglycemic subjects where placebo and thiamine capsules 300 mg per day was given for 6 weeks of therapy, systolic and diastolic BP was significantly reduced in participants at the end of 6 weeks therapy. In a meta-analysis where 6 trials involving 364 participants were assessed for glycemic outcomes and triglyceride and HDL cholesterol levels, benfotiamine in a dose of 120 mg per day for 3 months of therapy, it showed a significant decrease in HDL and there was a reduction in triglyceride cholesterol levels. By all these trials, we could make out benfotiamine role in the components of metabolic syndrome. Thank you for your time. Thank you for your patient listening.